And if you're going to speak initially from there, press your button. Yeah.
Well, I'd like to call this meeting to order. If I could have your attention, please. This is the inaugural meeting of the Legislative Committee of Dunn County. Welcome to all our visitors and to the board that serves here. The first order of business, I think, we'll take the roll call. Nick, you want to do that?
I do want to do it.
I knew you would.
Let's see here.
It's one of the fun jobs.
I just have to find the list. Let's see, Supervisor Steen,
Here.
Supervisor Headland,
Here.
Supervisor Johnson,
Here.
Supervisor Morehouse,
Here.
Supervisor Calabrese.
Here.
Supervisor Zons, he had sent in an email indicating that he wasn't able to be here today because he has another meeting. Okay. Supervisor McCullough. Here. Supervisor Kinnear.
Here.
Supervisor Rogers. Supervisor Quinn. And he also is going to be late. Okay, I'll keep an eye on, okay, well, you have a quorum of members.
Thank you, Nick. My name is Gary Steen. I'm the chairman of this committee. We'd like to welcome all the, evidently we attracted a lot of attention here. We got a lot of people. Our procedure will be, for those that want to speak, please sign in the sign-in sheet in the back, and we'll limit the comments to 3 minutes. So is there any questions regarding that? You can come up here and speak. We'd like your name and address. And then to speak, you hit the red button and the red light will come on. And
And remember to press the button with it looks like well, it won't be red till you press it. The one on the right. It's a person with some, yeah. Press that button. Yeah, and you can, if you want, you can just leave it on.
Okay, I'm Margie Hageman. I live in the town of Menominee at N 4624 440th Street in Menominee. And but it's in the town of Dunn, or town of Menominee. And I'd like to speak to the issue of healthcare. Healthcare is an essential pillar of our economy and economic security for all in our country. But our healthcare system is broken. And an estimated 30 million people are without health care. 44% have difficulty paying for their health care. Medical debt is the leading cause of bankruptcy, and we've all been to benefits or seen GoFundMe accounts. We have put Band-Aids on our healthcare system. And the Band-Aids are the Affordable Care Act is a Band-Aid. Medicaid, which is medical assistance in Wisconsin, is a Band-Aid. And Badger Care, Medicare is coming up to it this summer it's 57 years that we've had Medicare. These are all Band-Aids that have been put on our healthcare system. The question I have is healthcare. Is healthcare a right or a privilege? And the statistical outcomes here in the United States are that our healthcare is not as good as it used to be, that our healthcare is declining, and that our life expectancy is also declining, not just because of COVID, but because of the healthcare system. Other countries, other developed countries have developed have found ways to cover everyone with a national, nonprofit, national health system insurance. Why can't we? So many of us here in Dunn County and throughout the United States would like to see something on the ballot, but we want to see something on the ballot in November. And that would be, shall Congress and the United States and the President of the United States enact into law the creation of a public financed nonprofit national health insurance system that would fully cover medical expenses for all Americans. And that's all I want to say is I'd like to see it on the ballot. And if we can put it on the ballot in Dunn County in the November, it's a statement that our county, that the people in our county would want to express their opinion on this issue.
Thank you, Margie.
Mhm.
My name is Steve Brown. I live west of town at E 3652 State Road 29. And just a couple remarks I'd like to make. About 20 years ago, my wife married a professor in Spain, and they've lived there ever since. They have 3 children now. The oldest is 14. And a couple of years ago, I asked her what questioned her about the healthcare system they had, and they have both private and government owned or government sponsored. And so I asked her what she paid for their private plan, and about 2 years ago, she said it was $50 a month for a family of 5. And my daughter has some significant health problems, but she said they have never gotten a bill. They've never had to pay anything out of pocket for their health care. The other thing is about 5 years ago, after we visited with our family in Spain, we traveled to Portugal. And while we were there, my wife got severely ill. I finally took her into a hospital, and we were seen in what would have been their urgent care department. And we were there for about 3 hours, and she had unbelievable care. She had x-rays and lab work and treatment. She had IV antibiotics, IV Tylenol, breathing treatments. And we didn't have any health travel insurance. When we signed in, they asked us if we did, and I said no. And they said, well, you'll have to pay before you leave. I said, that's fine, because I knew their costs were pretty reasonable. So after all this care and meeting with the doctor, who spoke very good English, she was diagnosed with Legionnaire's disease and wasn't quite sick enough to have to go in the hospital, but she got the prescription for antibiotics. And her bill was 124 euros, which was about $160. If we had gone to urgent care here, I don't think we would have gotten out of there for less than $3,000. I started practicing medicine here in 1975, and at the time I thought the cost of healthcare was fairly reasonable, but over the years, I've just watched it balloon, and I watched healthcare go from, I think, primarily giving a service to our patients to just a huge business. And I don't know, it really just kind of makes me sick when I see what's happened to the healthcare system in the United States. It's a big for-profit system now. And almost all other, at least developed countries, their healthcare system is providing a service. It's not making profit. They charge what they need to provide adequate care. And I wish we could find a way for our country to do that. And I really believe that something on a Medicare for all system is the only way that that can be done. As Margie said, we've been putting Band-Aids on it, and it doesn't accomplish anything. So thank you.
Good afternoon, ladies and gentlemen of the board. My name is Greg. I am a resident of Lucas Township. N is a Nancy 6344 280th Street. It's west of town here, and I've come to speak to you today again about healthcare. And the question that I'd like to raise with this is, I think many of us in our community are well aware of the rising healthcare costs and sort of the unsustainability of healthcare as we have a elderly population that is booming. We have a very high percentage of elderly individuals in our country. And, as somebody who has been to 22 of the world's countries and received healthcare in 5 of them, I agree with our previous speaker when we look at the comparison of healthcare costs to our own. And, the question isn't why this is happening. The question that we need to raise is what can we do to change what is happening? And that I feel like is something that the majority of Americans have yet to take a step forward to do. Which is why personally I am imploring you to put a question on the November ballot that begins to start this process at whatever level of leadership that we can, because clearly that people at the top of the rung who, may be insurance lobbyists or maybe are benefiting far too much from the profits reaped by our healthcare and our pharmaceutical industry to make these kind of changes. And if they truly do represent the individuals that they say they do as elected officials, then starting at a local and a small government level is the kind of action it's going to take to have these changes made for the benefit of all people in our country. And that's really all I need to say about it, other than, as a young person, I watch people every day who are afraid to go to the doctor because the cost is unpredictable. And in a free market economy, the price of human life is infinite. And that is just a clear fact. So thank you very much for your time and have a good rest of your day.
Thank you, Greg. Steve Carlson.
Good afternoon, members of the committee. My name is Steve Carlson. I'm at N8426 River Road, Trigo, Wisconsin, from up in Washburn County. I drove down to this meeting today because I know some of the folks here. I've been on the phone with them and just basically came down to speak to 2 issues. The first is that there is a precedence for putting this kind of referendum question on the ballot. I was part of an effort, I think it was 14 years ago, a statewide effort to put a similar question, or at least it was about health insurance, on the ballot. It roughly read, should all Wisconsinites have health insurance comparable to their state elected officials? And as you can imagine, it was pretty popular. I was in charge of kind of the northwest corner of the state, and we were able to get it on the ballot in, I think it was Polk, Barron, Douglas, and Ashland counties. So this has kind of been done before. It's been a while. And I'm also part of a group that's trying to organize in Washburn County. We have some contacts up in Douglas and Portage, and we're going to be going forward and try to do something similar in the spring elections. So I really hope that this committee will consider this strongly. I realize I'm not from Dunn County, but I just kind of wanted you all to know that. And I hope you'll make a decision to put it on the ballot. Thank you.
Thank you, Steve. Jim Tripp.
Thank you, Mr. Chair. I'm Jim Tripp. I live at 621 Fagstead Street in Menominee. I have a whole list of points, I think 762. So how many, anyway, my point really is this, there are really a lot of ways of talking about this issue, but I support the referendum, the resolution to have a referendum, because I really think we need to start a discussion about healthcare system in this country. And I take a little bit different approach. Let me make just a few kind of random points. One of the things that I hear a lot is that the United States has the best healthcare system in the world. Now that's true for some folks who can afford it. Not so true for others. One of the statistics that I've been tracking for years is what percent of the money of the dollar spent on healthcare actually goes to provide healthcare. And right now in the United States, about 30%, 30 cents out of every healthcare dollar goes to pay for marketing and bookkeeping. 30 cents out of every dollar doesn't go anywhere near making you or your family feel better. That's a pretty inefficient way to operate things. So what I prefer to do is not talk about changing the healthcare system. It's talking about how do we pay for the healthcare system. And the way we do it now was designed by two crazy people who are now suffering the consequences in Hades. A couple of other points that you will hear made very frequently when you talk about this. If you talk about national health care, people will say, I do not want the government making my health care decisions. And my response is always the same. Oh, you're happy with the insurance company doing that. You talk to any family in this county or in America, and they can tell you a story like the one I will tell you about my son, who was suffering from a significant illness. He was seeing 2 or 3 doctors, and after extensive testing, they all agreed on the procedure that had to be done. The only thing they had to do was get the insurance company to pay for it, but the insurance company would not pay for it until the doctors went through the set of protocols in the order that the insurance company insisted on. It took an additional 2 months, during which time he suffered severely, to come to the same conclusion that the doctors had come to only on their own before. You talk to any family in America and you tell me that now you're making the decisions about your healthcare, you and your doctor? No. The insurance companies are making those decisions. If it came down to my choice, I'd rather have the government do it. At least I can unelect the fellas. And I was going to say something else. Another point I'd like to make. The United States right now spends about, and I'm sorry, but my statistics are a couple of years old, about $30 million marketing prescription drugs. And you can all nod and smile and say, yeah, I see those commercials on TV all the time. That's about 1/3 of the money that's actually spent on marketing. The other 2/3 goes to the medical providers. So for every dollar they're spending on advertising on CNN for whatever those drugs are, they're spending $2 directly marketing to medical providers, medical care providers. That's not an efficient way to run the system. That's not efficient at all. Let's get right down to Dunn County. Talk about how much does it cost to run a system. I'm not for sure about the numbers, but I'm pretty close when I say that the budget for the HR department for this year for wages and salaries is a little over $400,000 a year. I am not saying anything negative about our department. They have and continue to be a very good bunch of people, very well run, very efficient. But my guess is that 1/2 to 2/3 of all of the time of these talented people that we're spending a lot of money on is spent simply administering our program. Just administering it. We spend in this country an inordinate amount of money on stuff that's got nothing to do with taking care of you and your family's health. We need to change that, folks. Okay. And you're going to hear lots and lots of arguments from people that don't understand that or don't like the idea. So I'm going to leave you with one thing, and this is a good socialist suggestion for you. I want our healthcare system, which I believe to be of vital importance, to have the same kind of responsibility taken for it that our defense system does. I didn't notice anything in our HR budget department about making sure that the Army is well equipped. Let's run our healthcare system the way we do defense. Let's put it in the hands of a central agency that has the ability and the efficiencies to make it run the way it ought to run. Thank you.
Thank you, Jim. Steve Hotchkiss. Yeah, I butchered it. I apologize. Yeah, Hogset, yeah.
Thank you very much for the opportunity to address everybody this afternoon. My name is Steve Hogseth. I live at 614 Woodridge Court in the city of Menominee. And my intent today was just to come out here and tell you that I want to encourage you to strongly consider putting this on the budget or on the ballot. And that was going to be about all I was going to say. But then Mr. Tripp just made some comments, and I'd like to make a comment or two on those. Margie Hageman made some introductory comments, and I thought, right on, well stated. So I'm just going to just add a little bit to that. Now, Margie talked about, is healthcare a right or a privilege? Well, I think it's a right. I think it's a right for our citizenry to have a public education. I think it's a right for everybody in this room, when they turn on the faucet, to expect a clean glass of water. And when they breathe outside, that the air is not polluted. I think those are all rights, and I could go on and on and on. Now, Mr. Tripp mentioned the 30% of healthcare costs is on administration. And when he said that, I could not help but think of just yesterday. I was on the phone. Thank God I am blessed with good health. And I was on the phone to make my annual physical appointment. Talking with Mayo here at Red Cedar Clinic. And I was talking with the person to make the appointment. I was talking with that person about the time since my last checkup, when I could have my next one. This person was saying something that I didn't agree with. And I thought, well, wait a minute. And she said, well, you better check with your insurance company. So I hang up. I made my appointment. I hang up. I call my insurance company. We go around a little bit back and forth. Well, the bottom line is I ended up making another call back to Mayo and told them about what the insurance company told me. Then I had to change my appointment, and it was just a back and forth. Like there were like 4 calls where one call would have sufficed. And so it's just a lot of wheel spinning, a lot of little red tape. And that is just a little smidgen of the administrative costs that Mr. Tripp talks about. And I'm sure a lot of us in this room have had experiences over the years that we could share our own little stories. And I could share one on an MRI that I had about 3 years ago that ended up almost costing me an additional $5,300, but I'm going to just not go there. Thank you very much for the opportunity to speak, and let's put it on the ballot, okay?
Thank you, Steve. Lorene Vetter.
Okay, thank you for the opportunity to be able to speak to you all today again. I am Lorene Vetter, 515 21st Street North in Menominee. I am a retired physician and associate to Steve Brown. And We were both in the internal medicine department. I have been canvassing in Dunn County this spring, and it is almost universal that our fellow constituents believe that everyone should have access to health care, even those unable to pay for it. Now I have a question for the audience. Would everyone here in favor of a referendum for universal health care, publicly financed and nonprofit, be on our ballot in Dunn County in November? Would you please stand up? Thank you very much for being here. And thank you to the board for listening to us.
Thank you, Lorraine. Monica Barrier.
All right. Hello, I'm Monica Barrier. I live at 1918 Trimble Trail. I'm also the county supervisor for District 13. So like the others, I'm speaking today regarding the referendum for national health care. A question has come up about whether this is really county business. And I want to make the argument that it really is in the county's interest to be advocating for a better healthcare system. And I'll do this through the perspective of our budget and whether the current system is a responsible use of taxpayer dollars. So when I first started looking into this, I looked at the numbers from the meeting packets from the Committee on Administration for the past 3 months. And what I found was that the county had spent around $500,000 each month on health insurance for the past 3 months. And when I first saw this, I thought that's got to be some mistake, right? I got to be misunderstanding something. So I pulled up the one-page 2022 budget summary. And in 2022, we've budgeted around $10 million per year for health insurance. And that's out of a $90 million budget total. That's not just personnel, that's all county operations. So 10 million out of 90 million, or about 10% of all county operations health insurance. So we're spending a lot, but when we compare that to what the employees are actually getting, it's a pretty bad deal. Just like everybody else, they're part of a system where delays and even outright denials of care are routine. I don't know how anybody can look at this and think that this is a good situation, but it's the system that we're stuck with. I believe that as elected officials and stewards of taxpayer dollars, we have a responsibility to demand better of the federal government that serves us. I want to close by thinking about what we could do with this money instead. We all know that the budget process comes down to haggling over $50 here, $100 there. And a couple of months ago, we had a good discussion about the wheel tax. And many of us, including myself, are worried about the potential impact that this might have on people who can't afford it. For comparison, the wheel tax brings in just $700,000 every year. And that's peanuts compared to the $10 million we are budgeted to spend on health insurance this year. You know, instead of wringing our hands over the wheel tax, we could be just fixing the roads instead. So for all these reasons, I think that we as elected officials really have a responsibility to advocate for a more efficient healthcare system. I urge you to move this referendum forward to the whole county board. Thank you.
Thank you, Monica. Luisa Jeremaso. I'm sorry if I butchered it.
I
Yeah.
don't take any offense at all. That's a very hard name. It's Greek, so you can say it's Greek to you and you'd be totally fair. I'm Luisa Gerasimo, N 5797 163rd Street. That's in Lucas Township. And I also support the idea of putting this question to the ballot. And I'm going to tell a very short story. Promise I'm way under 3 minutes. So my husband has a relative who fell and broke his hip. If you guys remember a couple winters ago when everybody was falling and breaking their hips, we had ice, ice, ice. He didn't have health insurance. He did not go to the doctor right away. He was in tremendous pain, but he had no money and he didn't want to ask anybody for money. I wish I had known about this when it happened. We would have gotten him to the hospital and we would have gotten him seen. He is permanently in pain now. He finally got care. He couldn't pay for that care, so put him in an additional financial strain. He couldn't work because of the broken hip and the long recovery from a delayed surgery. And this gentleman took to drinking because he was in so much pain and so depressed about not being able to work. So we have a guy who was able-bodied in our county who was contributing to the economy by paying rent, going to restaurants, having fun, had a job, who now has barely a job, cannot really afford his apartment, is having to lean on family to get that monthly paid, and is so depressed that he's really, I am afraid for his life. And I'm not saying that he probably didn't have a downward trend for other reasons at different places, but this really seems to me very easy to lay at that moment when he fell on the ice, broke his hip, and did not get health care because he couldn't afford it. And I see this as my mom, who was a farmer, was very wise about prevention. The cost of something upfront versus putting it off, and then paying for it. And I think for our county, I mean, beyond the whole country and the millions and billions that we're paying, we have a profound opportunity to prevent trauma, to prevent the money that we will be losing from people being contributing. And the trauma also causes family breakdown. So families have fallen apart over gigantic medical bills that they can't pay. And I have lots of my friends who went to the same school that I did, who graduated at the same time, who are working abroad, mostly in Europe. And they're going to retire sitting pretty in a few years. My family, nobody in my family is going to retire sitting pretty. And most of the reason for that can be laid at having to pay off medical expenses, even though we were insured, for months and months and months. And that is money we did not spend in Dunn County on all the things that you can spend money on right here in beautiful Dunn County. So that's all I have to say. Thank you.
Thank you, Louisa. Cynthia Welsh.
I didn't write anything down, so I think I will try to keep my thoughts coherent. First of all, my sister had fallen several years ago. She had to go in for an MRI or whatever they call it. And the doctor said, you have a buildup of something in your veins, in your arteries. Turns out it was calcium. We do not shed our calcium. Those doctors in Milwaukee recommended that all of our family members have that scan, have a test for it. But my insurance will only pay for the scan if I first have a heart attack. Luckily, somebody in the insurance office, and I was working for the University of Eau Claire at the time, they made a mistake and they approved it. So I got my scan. I am now on medication to keep my cholesterol low. I need to watch my diet. And when Dr. Walker was retiring, when I went for my first or final checkup, he said, stay on the cholesterol medicine. Take the baby aspirin that they are now saying is not necessarily needed, but in my case it is. And I watch my diet and I exercise. That's the first part. If I had had to wait for my first heart attack, I probably would not have survived it. Women don't survive heart attacks like they do on television. Number two issue is we travel. My husband likes to travel. Once in a while, I'll go with him. We go to Europe and we always ask, how do you like your health insurance? In Munich, the tour guide said, we love it. We don't have to worry about who's taking care of mom or dad. In Canada, they say, we like it. I don't know why the United States doesn't have it. Yes, there are delays, but your elective surgery will be delayed here too. So we ask in England, we like it. My sister traveled in Norway and she asked somebody about universal health and their education. Yes, we pay higher taxes, but look what we get for it. What's the matter with you Americans? And the latest I heard is the United States leads the world or the industrial world in maternal deaths during childbirth and during child labor. And who is predominantly affected? People of color, low-income people. Even with the affordable health care that was supposed to help, but they'd had to compromise too many times. I pay $300 a month for my supplemental insurance. I pay over $300 to carry the long-term care insurance. My husband has Parkinson's. He will end up in long-term care. And that is not covered by Medicare. What are we doing to our senior citizens and our low-income people? We are our brother's keepers.
Thank you, Cynthia. Our last speaker is Chase Potter.
My name is Chase Potter. I live in the town of Sherman at N7681 500 Street. I also serve as the town chairman of the town of Sherman. First, I wanted to echo Supervisor Barrier's comments in that rising healthcare costs are absolutely a question of both county and town government. Except the town of Sherman is in a slightly different situation. It's not a question of cutting the healthcare out of the budget. It's a question of putting it into the budget. Currently, we don't provide healthcare at all to our employees. And so far, we have employees that are willing to work for us under those circumstances. I don't know how long that's going to be true. And I'm worried that at some point, our employees will retire and new ones will come in and they'll expect health insurance, at which point we won't be able to pay for it, at least not if we want to continue repairing roads, which, to be perfectly honest, is really the most important thing that the town actually does. I'd also like to speak briefly on a more personal note to some of the comments regarding single-payer healthcare in other countries. I've lived or worked or studied in some of these countries. I studied at a German university, I taught English in Switzerland, and I worked for the US Department of State in Austria. And in all of these places, I absolutely felt that I had far more access to affordable healthcare than I do in the United States. Now, I know that putting this measure on the ballot, whether or not it passes, is unlikely to have a direct effect on our national healthcare policy. That being said, I firmly believe that it matters what we say and what we do, and that we fight to make this country a better place. And therefore, I'd ask that you vote in favor of placing this on the ballot. Thank you for the opportunity to comment.
Thank you, Chase. I'd like to thank all of our speakers today. That concludes the public comment section. The next order of business is items placed at the request of the chair, 4A, the legislative agenda, which hopefully everybody had a copy in the packet. It sums up what we had put down last year, and I would urge all the department heads to go back to your departments or your committee heads, go back to your departments and start the process for this year. If there's any additions to what we have from last year. And I think, and of course it's up to you folks, but I would suggest that we shoot for having our legislative get together with our representatives the first or second week in January. I think that can be more effective for a response from them. So any comments on legislative agenda?
Mr. Chairman?
Yes.
What is your anticipated deadline for committee review of the legislative agenda?
In the past, the committees and the department heads have worked together to make additions or deletions and discuss these things. And of course, it came before the executive committee. It was last year, it was approved at the November county board meeting, the final version of it. So you have, a couple months to
So it
do
would
the
come-
work.
It would, excuse me, Mr. Chairman, if you will permit, it would come to executive in October?
Well,
Yeah,
the legislative
Yeah.
committee now, yeah.
We had
Yeah.
that legislative committee, yeah,
yeah.
right.
right. I
Thank
think,
you.
I don't anticipate a large degree of change. There might be some additions. But it seems like some of these things are ongoing themes that we've had for a number of years. So if that's agreeable, that's what we'll shoot for, to bring it to the executive or the legislative committee in October. Okay,
And I will distribute
Yeah.
the legislative agenda to staff and encourage them to.
Yeah, if I might, if we can get it before our legislators in early January, that would be ideal. I've had a conversation with a couple of them, and they suggest that with the way the state budgeting process works, they are much more amenable to being able to do things if we get the information to them sooner.
thank you, Chair. 4B, support for national health insurance, and I guess I would open up that for discussion or any ideas that the board has regarding that.
If I might.
Yes,
So one of the things that I'm trying to do with this is separate out two very important and distinct questions. I work in the entertainment field. Many of my peers are international. I travel internationally a lot. I am in complete agreement with the policy goals that have been expressed by the people who are here. I agree with the differing situation when you travel internationally. The place where I have a question is I'm not sure that a non-binding referendum is going to serve those policy goals in any meaningful way. I would very much like to believe that Dunn County passing this would have some impact. I have at best sincere doubts that it would. So while I strongly support the policy goals, and if I could wave a wand and make them happen, I would cheerfully do so. I am more dubious about the idea of a referendum, particularly a non-binding referendum. I do not believe, given the partisanized atmosphere around healthcare, and I don't think it should be a partisan issue at all, but it has become an extremely partisanized issue, that this will move things much at all. And I think it will probably be quite a rancorous debate at the full board to pass this, and I don't know that it will pass. But I'm certainly open to the idea, but I have, like I said, I have doubts about the means serving the goal.
thank you, Board Member McCullough. Any other comments from any of the board members?
Yeah, Mr. Chair, if I could.
Yes, Mr. Calabrese.
Yeah, in the past with non-binding resolutions of all kinds, I've always tried to, I think I have the same question. What does it do? What I want things that have direct results. But I do think that the most important part of this discussion and this topic is to start the conversation in a way that doesn't have that partisan rancor that you talked about. And while it won't, while it's difficult for us as this board to even foresee that we will be the ones to start that, I think it's important to try to. And the reason that this one seems different to me is because I've sat on that administrative committee as well, that Supervisor Barrier mentioned and Mr. Tripp mentioned, I believe. And I did not know the numbers. I had no idea that it was that much that a county was spending. And I think that aside from the language of the resolution and people seeing it as something that's a national issue, which it is, I think it's an opportunity for us as supervisors to let more people in the public, because I believe that even many of the people in this room still did not understand those numbers until they heard them today. To think that $500,000 a month is being spent And then we think of all the department heads putting in their budgets and cutting here, cutting there, eliminating the home health care program, all the things we have to do as a county board. To think that what I have seen on my time on the board is that reasonable perceptions based on the budgets, based on the constrictions that the state puts on the board, have softened a lot of political rancor. I know people on this full board who are likely conservatives, likely Republicans, and I know some who are on the other side. But when it comes to these issues that are like on the legislative agenda, they don't see them that way. They say, why are the Republican lawmakers, even if they're conservatives on the board, why are Republican lawmakers strangling us with so many mandates and levy limits? And they're like, no, I want the nursing home to stay open. I want my employees to be taken care of, and I want the department heads to get what they need to provide the services that we have to for our residents. And so I think that putting this on the ballot will enable us as supervisors to speak in the public and for people to hear and learn just what the possibilities could be under the system that is ubiquitous in the rest of the developed world, and just how much benefit it could do to the county's budget, which is always such a rancorous debate. Thank you.
Thank you, Mr. Calabrese. Any other board members have anything they'd like to say? Mr. Kinnear first, and then Mr. Headland.
As Supervisor Calabrese said, this is more of a educational opportunity. Is that kind of what you said? Okay. I could see that. What is the downside? Oftentimes I know if you make a rule and you can't enforce it, it's worse. Is this the same kind of thing? So is there a downside to having it on as a referendum?
Thank you, Supervisor Kinnear. Supervisor Headland.
I guess I was gonna speak to that same area, is that if in fact, I totally support the idea, you know, of a sound system. Is a Canadian system sound? No, it's not. Okay, it's not. And it's not because the elderly people love it, because they haven't had to pay into it and they're retired. The young people who are struggling to put food on the table and pay their for their home don't like it much. So but they have one and it works. But so from that point, could it hurt? Yeah, it could if it didn't pass. You know, what would be the message if we put it on a referendum and the people of the county, the majority of them say no? I came in here thinking today that, you know, let's find out, but there is a downside. That's just a comment. I still like the idea of finding out, but we may have to live with something that we don't want.
Thank you, Supervisor Headland. Supervisor Morehouse.
Thank you, Mr. Chairman. I don't mean to put him on the spot, but I would like to know from our county clerk what the costs of this are and what it, I mean, and you probably don't have numbers, but what it takes in terms of staff effort and time.
Sure, that's an excellent question. I'm Andrew Mercil, the county clerk, for those of you who don't know, although I feel like I know all of you back there. The costs would not be an increase on the costs for the ballot, provided that it didn't extend the ballot more than anticipated for the length of the ballot for the November election. Currently, the partisan primary that'll happen on August 9th is a two-sided ballot because of all the candidates running. The anticipated length of the ballot would be one-sided ballots for the November election. And with the narrowing of the willowing of candidates through the partisan primary, there should be plenty of space on a one-sided ballot for a small referenda question such as this. So it wouldn't add any increased costs whatsoever. And since it would be across the county, it would be on every single ballot in the county. There would be no cost associated with that.
there would be some additional publication requirements. I think about maybe $1,500 or something, depending on the length. The question is pretty short. I think the explanation for the question that has to be published also would be relatively short. And so my guess would be between $1,200 and $3,500, assuming the ballot isn't impacted, so that extra ballot space is needed.
Yep, and there was additional publication funds set aside in the budget this year in anticipation of a referenda, as that was discussed last year, as potential for this coming fall. So that's already, there would be no additional funds needed for that.
Supervisor Morehouse, does that answer your question?
Yes, it does. And if I may,
Yes.
like Chairman McCullough, I am entirely supportive of this. It's long overdue, national health insurance in this country. I am deeply, deeply skeptical that this will have any impact at all. But that notwithstanding, I'm going to move that the legislative committee approve the placement of this non-binding referendum on the November ballot. And maybe there won't be a second, and maybe it won't fly.
We got ahead of ourselves just a little bit here. We're still on 4B, support for national health insurance. And I'd just like to make a comment on national health insurance. We're the only industrialized country in the world that doesn't have national health insurance. Which is unbelievable to me, but anybody that has to go, my wife and I look like a drugstore when we travel now. We got so many pills. The last time we came back from the drugstore, I commented to my wife that if we did not have insurance, we couldn't take our drugs. We would not be taking them. We couldn't live. Why our country, the richest country in the world, doesn't have national health insurance is beyond me. I think we know why. Insurance companies, big money, drug companies. And I feel that I too don't think that this is going to have an impact, but the impact is that I feel that we are listening to our people and we are doing the right thing, supporting this. Is there any other comment on number 4? Mike, Supervisor Rogers, pardon me.
So I guess I would have a couple of questions as comments. And part of this has already been said. But how do you word the referendum to get some value out of it? We'll have long conversations on how to word the referendum as far as how it's wrote. What will it really accomplish? I don't know that we accomplish nearly as much as what would be hoped. Whereas the grassroots movement, where we have this many people speaking up over an issue, will go a long ways to start to move people in the direction of paying attention. I think everybody wants to have good health care for everyone. And I don't think that is necessarily something that can't bridge the political parties, and that's not something that is foreign to anyone. We all want to have that for everybody. There's many questions on how it's utilized, how it's put into play, who pays for it, how it's paid for. So it's not really as simple as we just have it. If it was that simple, I got to believe it would be already done. So I'm not going to stand in the way and oppose a referendum. I kind of think it's spinning wheels on a process that's not going to accomplish very much when the efforts can be put out there, as we've seen today, that begin to encourage everyone to get on board instead of putting it on a referendum where it becomes a more of a split issue where people begin to fight over it and take opposite sides on it. So I don't know that it will accomplish anything, and it may hurt more than it accomplishes, but I won't stand in the way of a referendum.
Thank you Supervisor Rogers, and with the committee's permission, I'll move down to item 5. And with Diane's permission. At this point, a resolution for advisory referendum regarding national health insurance, and I guess my question to the, what is the board's pleasure?
Well, Mr. Chairman, with my apologies for jumping the agenda, I would move that this committee direct send this a referendum proposal to the county board.
If I might, Chairman McCullough can correct me, but I think that this would go to the executive committee first and then to the county board. Am I wrong or right?
No.
I was wrong. I take that back.
Chairman
Okay.
McCullough did school me before I made that
Oh,
motion.
okay. Well, then, and I just got schooled, so I guess it can go to the board then. We have I didn't mean to cut you off.
No.
All right.
Good.
We have a referendum that we would move ahead, or I mean, a motion that we'd move ahead for a resolution for advisory referendum regarding national health insurance. We have a motion. Is there a second?
I'll second that, Mr. Chair.
We have a second. We have a motion and a second that we move this forward. Is there any discussion? And I think we've had. Yeah. Supervisor Quinn.
I apologize for missing the discussion, so I don't really have any, not capable of responding directly, but I a procedural question. Is there, I'm assuming that there would be an opportunity for the board to review possible modification of the resolution?
Yes.
Yep.
It would come to the County Board of Supervisors at your meeting next week in the form of a resolution that contains the question, and as with all resolutions, it would be subject to amendment. If there are different ideas about what ought to be in the question, maybe more detail or whatever, it could certainly be inserted.
So if I'm understanding you correctly there, counsel, in answer to Mr. Supervisor Rogers' question, is that would be the opportunity at that time to fine tune the language, or prior to that?
Or at this committee, but yes,
Yeah.
the county board could certainly do that.
All right. Does that answer your question, Supervisor Rogers? Maybe, huh? All right. Supervisor Kinnear.
I know someone read the resolution or the proposal, but if there are changes to be made, it seems like it should be made here first rather than having 29 people talk about it. Maybe not made today, but it doesn't seem like we should be forwarding it and we're saying, well, we think this is it, but we're not sure. You can make changes if you want. It's very inefficient with 29 people. And to Mr. Rogers or Supervisor Rogers' comment, the less problems we have with it, the more information people have, then there will be less rancor. It'd be nice if everybody understood what was happening and it wasn't difficult to do.
Thank you, Supervisor Kinnear. Nick?
This brings us to a kind of a crossroad with this. In order for this to be on the November general election ballot in November, it will have to be in final form, I think probably by August 23rd, 24th, somewhere in that range. And so as a practical matter, if you wish this to be on the November ballot, time is quite of the essence. On the other hand, I think it's fair to say this is not an issue that is an emergency necessarily. And if you do want to spend more time with it and work on the language of the resolution or the referendum question, it's something that can be brought to the voters in the spring. There are other counties, I think, that are talking about doing this in the springtime. And it can come at either the primary or the general spring nonpartisan election. And so there are some options. It really comes down to what it is, what your preference is and comfort level with the language that's in there. And I'll confess, I'm gonna need a little help with the research on some of the data. I might call Jim Tripp up and ask him to give me his notes. The draft that you have doesn't have background information in it because I couldn't find anything that was really current. But I can get it done if you want to hear it next week.
Thank you, Nick. And we have a motion and a second, and the way I see this then is that the motion and second is for moving the referendum forward with the wording that we have here, which is pretty straightforward, actually. Shall Congress and the President of the United States enact into law the creation of a publicly financed nonprofit national health insurance program that would fully cover medical care costs for all Americans? So as I see it, we've got a motion and a second on the floor to vote on this, just as it's written. So I would, Supervisor Calabrese.
Mr. Chairman, thank you. Yeah, I like the basicness of it. And especially since we all know that obviously this passing in Dunn County is not going to change our healthcare system. But if we view it as a conversation starter and we know that other counties pay attention to what other counties do, and we know that I know that many of us are looked up to by our constituents. I think of Mr. Rogers. I think of we all say Mr. Rogers. It's supposed to be Supervisor Rogers. I apologize. Yeah. But if I think I'm envisioning that these questions about this question will come up, and I envision people approaching us in your communities, in your town, in your store, wherever you see. And if Supervisor Rogers or Supervisor Johnson or someone says straightforward to you, what do you think? Not about the referendum itself, not about its impact in the country, not about is this a good way for the board to spend their time. If they say to you straightforward, what do you think about that, a national health insurance program? And you have to say, yes, that means a lot to people. And it shows that I think someone else mentioned that because it's just one of the most pressing issues in everybody's life. And so I think to keep it as basic as possible is a good idea.
Thank you, Supervisor Calabrese. Supervisor McCullough.
And I believe the language here is, if not the same, similar to the language that's being used in multiple counties around. The goal is to get the same referendum passed everywhere, more or less.
Yes, more or less.
Well, given that, I think probably wordsmithing it would be counterproductive.
Supervisor Johnson.
I should talk more. I'm guessing there are other counties that are looking at a referendum for November. Is this correct? Does anybody have any clue sitting here?
I thought of Claire.
Okay. I was just curious.
Wasn't there a county up north too that
Or
was?
this Washburn County, but yeah,
Okay.
I'm not sure how far.
Is everybody done? Supervisor Rogers.
Can you read
Yeah. Question for the referendum. Shall Congress and the President of the United States enact into law the creation of a publicly financed nonprofit national health insurance program that would fully cover medical care costs for all Americans? Now, there's some wording above that, like now therefore be it resolved at Dunn County and that stuff, but that's the heart of what we're going to vote on here in a minute, and I'm going to call the vote. Now, unless there's any other discussion, I think it's time to vote here. So, Nick, would you want to, or should I take that?
Well, you can I can just do it voice vote.
All right. All those in favor signify by saying aye.
I,
Opposed? Unless my hearing went to heck, it passed, so thank you all very much. I'd like to thank all the people that came today. And that, yeah. Executive board. Would that be agreeable? Okay, so the next, and I don't have the date on that, but we'll meet 1 hour prior to the executive board meeting in August. Yep. All right. Pardon? Yeah, yeah. Being that concludes all the business that we have, I am adjourning the meeting.